Now, in previous videos, we've talked about the displacement of the disc, the clicking, the locking of the joint, the pain, and what that means, what that articular disc going out of place means. I drew some pictures. Now I want to show you some representations, some real good drawings to show you exactly what's going on in the joint and how we can probably treat this problem. If you recall from the last video, we discussed putting the articular disc back in place between the condyle and the articular eminence of the temporal bone to reduce the discal dislocation in the TM joint. That, in theory, should reduce pain, swelling, ear pain, headache, pain, those kind of symptoms, and stop the joint clicking and or locking. I just want to show you a few pictures. First, I want to show you the picture of the TM joint. The TM joint, as you can see, is the most complex joint in the body. Now, I know that you think that the knee or the shoulder are complex, and they really are, but in creation, the TM joint is the most complex joint in the body. Here's the condyle, the articular eminence, the temporal bone. Here's the articular disc between those bones, temporomandibular joint. There's a posterior band and anterior band. There's a tissue right here called the intermediate zone, but this back here is what's interesting to us. This is called the retrodiscal tissue. This tissue is full of elastin fibers, some collagen fibers, but also blood vessels and nerves. So if one is struck in the jaw and drives this mandible posteriorly and crushing or smashing or compressing this tissue right here, there's intense pain, swelling, and even bleeding in the joint. Here's a histological slide right here of the condyle, the articular eminence, and a normal TM joint, normal disc in the TM joint interposed between these two bones. And here's the retrodiscal tissue. You can see if this is pushed backwards, this is going to cause some swelling, pain, and actually, after a while, sever that tissue so the disc will permanently dislocate. This is a picture, a drawing of a normal TM joint. As I said earlier, you can see the disc, the temporal bone, and the mandible right here. And here's that retrodiscal tissue with the elastin and collagen fibers, blood vessels, and nerves. And the last thing we want to do is have this condyle pushing and compressing this tissue. This is what a disc looks like, a drawing of a disc looks like when it's out of place. The disc is displaced forward like this. It folds upon itself. That's what you'd see on an MRI. Here's the retrodiscal tissue now interposed between the condyle and the temporal bone, crushing or compressing this tissue, making it very painful, causing swelling and even bleeding in the joint, causing clicking. And that way you know the joint is out of place. Some of the symptoms, let's review them, of the displaced disc would be clicking in the jaw joint, a possible locking of the TM joint, not always, but presently, not always, but commonly locking of the joint pain, headache pain on the same side, a change in the occlusion or the bite of teeth. I had a lady just this past week from out of state that came to see me, and all she could do is hit on the one side, and she couldn't hit on the other. The other side, the side on which she couldn't hit, was the damaged side because there was swelling in this area and her teeth wouldn't come together. So there's headache, change in the occlusion, ear pain on the same side, muscle pain, facial muscle pain, especially if one clenches and or grinds their teeth when they sleep, and also neck and shoulder pain. Now here again is a normal position of a TM joint with the disc, the condyle, and the articular eminence with an interposed splint or an appliance. We call this an anterior repositioning appliance. It can either be on the upper jaw or the lower jaw. In our office, we put one on the lower jaw during the day and one on the upper jaw at nighttime. This little lip right here, as you can see the teeth right here, this tooth, will prevent your mandible from falling back and damaging this joint when you sleep. Here's what this centric relation appliance looks like, or on the lower jaw looks like on the articulator before I put it in the mouth. Here's what it looks like. It almost looks like a removable partial denture. It's very comfortable. Here's the normal condyle disc and temporal bone assembly, and here's what it looks like, this centric relation appliance. And you can see that's aesthetically pleasing. This person can learn to speak well within a day or so, and there's not a lot of impediment with their speech when they talk. They may have to take the appliance out when they talk on the phone, but when they give lectures, they give discussions in business meetings, they can talk with this appliance. They can go to the store, they can go to church, they can go to anywhere they want with this appliance in place, and people wouldn't even know it. And here's what it looks like in the mouth. See how nice she looks? I know she looks nice because that's my oldest granddaughter, but I just want to show you that's what it looks like. She actually had a TM joint problem, and she's doing great now. Here's the upper appliance called the Farah appliance. The person wears this at nighttime, and it was It was invented by Dr. William Farah of Montgomery, Alabama, who is my mentor, Dr. Edwin Ernest, Dr. Ernest's mentor. So I studied with Dr. Farah and Dr. Ernest to learn how to make this. And that keeps this little lip, keeps the lower jaw from falling backwards and damaging the joint at nighttime. Here's what it looks like on the articulator. Here's what it looks like on the mouth. You can see that little lip, the teeth closed in here, and they touch right here, and they don't let the jaw fall back. Now here's the funny thing. Here is an over-the-counter appliance that a lot of times the dentist or physician or physical therapist or chiropractor may tell the patient to buy an over-the-counter appliance. Now look at this. Does that look comfortable to you? Now look at this picture. That's hardly comfortable. I don't know why the FDA ever approved these things, because these actually cause damage. They cause tooth movement, they cause joint problems, and they are not comfortable whatsoever. The patient can't talk with these appliances. Here's what it looks like at nighttime. Now that can't be comfortable, over-the-counter appliance. So here's what Emily looks like with her appliance in place. Doesn't that look nice? Thank you for watching this video. If you have any questions or comments, put them down below. I read all your questions, all the comments. I try to answer all the questions, suggest topics for videos in the future, and I'll try to address them. Thank you for watching.